Right about now, families would normally be getting ready to welcome relatives into their homes. Obviously, this year is very different.
But for those who are traveling, you're going to want to do it safely, not just to protect yourself, but of course to protect all of those you love.
Yeah, here with everything we need to know is NBC News medical contributor Dr. Natalie Azar. Hey, Natalie.
Hey, Dr. Azar. It's great to see you. Okay, so let's talk about this FDA approval. I think people are wondering, like, when am I going to get the vaccine? It seems as if the FDA is going to go ahead with this. But what is the game plan after that?
Well, guys, so yeah, the EUA means that starting as early as next week, U.S. citizens will start to be vaccinated against coronavirus. And it's going to start with healthcare workers and likely individuals who live in long-term care facilities. And after that, it's kind of going to go as a rollout in waves or phases. Likely next will be essential workers and then individuals with, chronic medical conditions, older folks, and then the general population. So it's going to take many, many months, but that's how it's going to start. And it's going to start as early as next week.
So, Dr. Natalie, Hoda and I were talking. I bet there are tons of people watching right now that are wondering, well, when is my turn?
Right.
How do we know? And what are we going to get some sort of text that says, go to your doctor? Where are we going to get these vaccines?
That's a great question. Great question, Jenna. And so I think probably the hospital systems will be doing it slightly differently everywhere. Our plan, for example, is that we're going to do the workforce first, and then we will start to make it available to patients. And again, these plans are being made, as we speak, so nothing is necessarily set in stone. What my expectation is that when your doctor orders your test, there will probably be like an algorithm. What is the patient's age? What are their comorbidities? What medications are they on? And that will sort of guide you to whether or not you actually qualify for the vaccine. It's my expectation that there will be, hubs set up at different hospitals where patients can get their vaccines. At some point, we'd like to see potentially that people can go to the pharmacy to get it. But I think in the short term, it's going to require a doctor's order, and it will be very, very organized and formalized.
Dr. Natalie, I've already gotten 2 texts, one from CVS and one from New York City Langone Hospital saying, we're on top of it. We're going to let you know. It just came to my phone. I was like, oh, it just makes you think they're ahead of it. So let's pretend people get the vaccine. Does that mean that we say bye-bye to the masks?
Not right away. And that's, of course, the question on everybody's mind is like, okay, now I got my vaccine. I'm probably immune. Do I not need to wear my mask? And the answer is no, you definitely do need to still wear a mask. When we can all stop mask wearing, well, look, we have to get to that golden number, that herd immunity number where about 70% of the population is immune. That's going to take a lot of time. And I think one of the biggest things, the biggest outstanding questions is whether or not vaccination prevents transmission. There's a difference between the vaccine preventing serious illness, which we know that it can do, and potentially even mortality, but we don't know whether it necessarily prevents infection at all. What if you've been exposed, you have the vaccine, you're asymptomatic, you may still be able to transmit that to somebody else. So that's a really, really important piece of information that we just don't have the answer to yet. And I think that will also help inform when we can sort of loosen the restrictions and guidance on masks.
I mean, I think there's no doubt that masks work, and that we should be wearing them.
Absolutely.
So as we talked about, the holidays are coming up. We're just 2 weeks from Christmas. What, the CDC says do not travel, but for those that are thinking about it, what should they be doing?
Right. So, the CDC does formally say, please don't travel if you don't have to. If you are going to be traveling, the recommendation is to get tested about 1 to 3 days before you travel, and then 3 to 5 days when you return. And importantly, we really are encouraging people when they return for about 1 week to basically quarantine if you can, pretend or act as though you were probably exposed during your travels, get your test, but still stay low. We want to really avoid people, unwittingly transmitting to other people.
Yeah. Okay. So I think just finally, people want to know, when's it all going to be back to normal? When are we going to go to concerts? When are we going to have the plaza outside? Like, when will all that stuff happen?
Our audience back?
Yeah. When?
I know. Well, I mean, again, we go back to this concept of herd immunity, and I think we will know when we get there, when we see, look at all the metrics that we're going to be following, percentage of positive cases, hospitalizations, deaths. At some point, when we get to herd immunity, the virus will have nowhere to go and we will have broken that chain of transmission. When could that conceivably happen? Look, if you listen to Dr. Fauci, maybe end of third quarter, that puts us around summer, early fall. I don't know that that necessarily means the masks are all coming off, but I think it means that life will feel a lot less restrictive, which will be a relief to all of us.
Indeed. All right, Dr. Natalie, thank you so much. We appreciate it.